go any further. So this recording will be made available to everyone. So if you guys want to watch it again, you might want to after we're finished. Anyway, for the benefit of those who aren't online yet, it'll be recorded. I will share my screen with you in a moment. Hopefully what you will see very shortly is, that's not going to help, so the introduction. Let's move that to the side. Can everyone see my screen?
Yes.
There's a presentation there.
Yeah.
Cool. Okay, great. So here we go. As I said, welcome again to Western Sydney University. Some of you have studied here before, some of you haven't. I'm biased, but I think it's a really great place both to work and study, and I hope you find it very much the case. Welcome to the Cardiac Sonography program. I know that most of you intend to do the graduate diploma. Some of you are hoping to do the masters. Whether you do the graduate diploma or the masters, the first 2 years are the same anyway. So what I'll focus on are the first 2 years, and specifically the first semester, so that you guys can become familiar with how things operate. So I'll go through some of the aims of the course, with, as I said, specific reference to the first semester, how the course is designed, clinical training, learning activities, assessments, the resources that will be available to you, the expectations, both expectations I have of you and you should have of me. Then I'll talk a little bit about the faculty and answer some questions at the end there. So the aim of the course really is to help you guys to develop knowledge and skills and professional ability so that you're able to perform high quality ultrasound examinations, that you're consistently acquiring images of good quality so that physicians can make good decisions about managing people and their heart disease. So it involves learning all the different aspects of echocardiography, from 2D to Doppler to tissue Doppler, and some of the newer technologies as well. So that when you graduate, you'll have knowledge and skills and professional abilities that are going to mean that when you graduate, you've got strong skills, but importantly, that enable you to advance further, because when you graduate, I think you'll come to appreciate that there's much more that you're going to have to learn in time. It's easy to forget things, and you're going to need to continue to improve. Nonetheless, you need to start somewhere. So we're hoping to provide you with the skills that enable you to have a strong foundation from which to start. There's just some newer imaging modalities from strain to 3D, which you'll get a little bit familiar with, especially if you do the masters. So as I was saying, that there are knowledge and skills and professional attributes that we want you to develop. Obviously, cardiac anatomy and physiology is a skill. You're going to have to be very familiar with anatomy and physiology of the heart and the great vessels. You'll have to come to understand different disease processes. In second and third and fourth semester, we'll be able to touch more on disease. To start with, it'll be sort of normal anatomy and function. Ultrasound physics will be an important aspect of the first 2 semesters too. With that in mind, there's a really, you guys will benefit greatly from the knowledge and experience of Dr. Rob Gill, who will give all the physics lectures, will give the physics tutors tutorials. There's a little bit of feedback coming back through the recording. If someone's got their speakers turned right up, if they wouldn't mind just turning them down a little bit, that would be appreciated. Obviously, this profession involves a very important practical element. So you're going to have to become very familiar with how to operate ultrasound machines. And machine operation is an important aspect too. Image acquisition and measuring image is important. The professional aspects too, you know, communicating with peers, with colleagues, with others as well. And then, as I was saying, having the skills so that in time you can advance professionally beyond your study here. In order to get into the course, you've all have to demonstrate that you've got a clinical training position. It's really important that you have and maintain that clinical training position for the duration of the course. It's important from a number of aspects. Firstly, we just can't provide you with enough in, you know, clinical training with the seminars that are held here at the university. The seminars are really important, and you're asked to attend the seminars, but you need to be honing your skills day in and day out. Secondly, the course is accredited with the Australian Sonographers Accreditation Registry, ASAR. And that means that when you graduate, you'll be able to apply to be recognised as an accredited sonographer. I mean, even as a student, you can apply to be registered as a student. But one of the things that accreditation depends on is that we've got to ensure ASAR that all of the people who are in our course have a minimum of 3 days a week, and some of you will have more. Now, if anything happens with regards to your clinical training, please let me know. It's not so that, you know, there's immediately a big red line, you know, a cross put through your name or anything like that. It's so that we can try and work out something. You know, whether it's just, you know, there's half a day lost or a day lost, or things aren't working out, because we're here to support you. We want you to be able to complete things. So there's a little bit about clinical training. Moreover, there's a sonographer there at the clinical training site who I will ask you to provide me with some details about their email address so that I can correspond with them, because I want to correspond with them often. I want them to be very much aware of what we're trying to do. It's best if we're all on the same page, obviously. And they're going to be an important person. Now, I'll say a little bit more about that. With regards to that supervisor, you've filled in a verification form. You don't need to send that in again, but I do need you to, using your university email address, to email me both your supervisor's name, phone number, and email address, okay? And please send that to me by this Thursday, because I want them to understand from the outset what we're trying to achieve. Obviously, I want to introduce myself. I want to thank them for supporting you, and I want them to be aware of some of the aims, you know, of the course, so that right from the very outset, they feel very much a part of what we're trying to do. Okay, so by this Thursday, please, their name, phone number, and email address would be much appreciated. So a little bit more about the course. So if you're doing the graduate diploma, there'll be 8 units of study over 2 years. And the units are named very simply. Makes it easier for me, and hopefully it'll make it easier for you guys as well. You either study principles units or practice units. Principles of cardiac sonography or practice of cardiac sonography. In semester 1, it will be principles of cardiac sonography 1, and practice of cardiac sonography 1. In the principles, generally speaking, the focus is the theory. So we'll focus on cardiac anatomy and physiology, normal anatomy and physiology, as I said, some of the embryonic development, features of the normal heart, size and shape, and valvular morphology, all that kind of thing, and ultrasound physics, from the speed with which ultrasound is transmitted through soft tissue, different aspects in terms of reflection, refraction, and a whole lot of things that you'll become familiar with. And then the other unit's the practice, and there we will be focusing on acquiring images and measurements, operating ultrasound machine, and communicating with others. Now, if you haven't started acquiring images yet, no problem. We'll start literally from the very beginning. With regards to clinical training, I'm going to jump back just a little bit. May I suggest that now is the time, if you haven't started at that place, that you need to start, because you're going to be expected to be starting acquiring images as of now. Okay, so that's what the principles and practice units sort of, generally speaking, that's how they're designed. The principles, as I was saying, theory, the practice, the more practical elements, but there's meant to be a link, as it were. They're meant to be united. So obviously you need to learn the theory about anatomy, but then you need to be able to acquire images so you can demonstrate the anatomy. You need to learn the theory about physics, but you need to be able to operate an ultrasound machine mindful of the properties of or physics theory, so that things like artifacts and the likes you can recognize, that you understand the limitations with regards to the operation of an ultrasound machine. So that's how we're going to try and link them. The course has been developed using a fancy teaching word called, it's a spiral curriculum. And that is to say, there's lots of things that you'll touch on to start with that we come back to, okay? So, there are elements right from the very beginning that will be again taught again later in the course, but each time that element is presented, there'll be an increased level of depth, okay? So there should be some logical development in things. Things are reinforced. And what that means is, for example, if we're looking at the left side of the heart, the systolic function of the heart, initially we consider the global function of the heart. And what we mean by that is the global, or the function of the left ventricle as a whole. That's in first year. In second year, we get a little bit more detailed, and we start looking at what's called regional wall motion abnormalities. So literally speaking, segments of the left ventricle, and getting down to finer detail about how each of the segments of the left ventricle are working. With regards to valve disease, we'll learn very early on how to qualitatively estimate valvular function, whether they're functioning normally or not. And in second year, really undertake some quantitative analysis so that you can give the cardiologist some clear indications about just how well or poorly a valve is working. And then with regards to congenital heart disease, a little bit of development early on, and next year we'll get into some of the lesions, the congenital heart lesions. So as of tomorrow, you guys will be able to access the views site, okay? And it's really important that if you don't have access to the views site by tomorrow, that you include in your email about your supervisor if you're unable to access it, because you should be able to access the view site. It's really important, okay? When you go to the university webpage, that's what it looked like earlier today. You'll see at the top, as you look at the screen, the top left-hand corner, that a little acronym views, and that's, in short, the e-learning platform that we use at Western Sydney. When you click on that, there's on the right-hand side, a couple of text boxes in which you put your username, which is your university ID, and the password that you've selected, and then you'll be able to access Views site. There might be one or two more clicks, but what it's going to look like is a site like this, okay? And this is going to be home for you guys for a lot of the time, okay? You're going to have to get very used to looking at this screen, because it's where you're going to access a whole lot of things like lectures, like tutorials. There's going to be announcements weekly. There's going to be assessment items posted. Your grades are going to be posted up via Views as well. So this is going to be something you're going to get very familiar with, used to looking at. Now, I'm not going to go into Views in all its detail, but I want to talk to you about some specific parts of it. What you'll see down as you look at the screen on the left-hand side are different parts: home, learning zone, communication zone, assessment zone, and support. And I'm going to go through those now. If we just go back a little bit, sorry. If we go back here, you'll see learning zone. And in the learning zone, you'll notice some acronyms here, PNCS, and that simply stands for Principles of Cardiac Sonography. You'll see another one there, PRCS, and that stands for Practice of Cardiac Sonography, okay? So rather than having the full text written out there, you'll get used to it, I'm sure, but in order to access the lectures, and they start next week, you'll go into this learning zone. The lectures for the Principles of Cardiac Sonography are as follows, okay? In the Principles of Cardiac Sonography, there are 8 lectures, and they're spread out. They're not all, they don't all occur in the second week. They'll occur, generally speaking, 1 per week for about the first 5 weeks, and then there's a few later on. We start with the very fundamental things, cardiovascular system and its development. Then there's some physics lectures, cardiac anatomy, essential physiology, hemodynamic concepts, cardiopulmonary circulation. 6 out of those 8 are online, okay? So most of the time the lectures are online, and you'll be able to watch them once they're available to you. You'll be able to watch them as many times as you like, okay? So you can go through them carefully more than once. Moreover, there'll be the full lecture available to you, and what I mean by that is all the audio and the images, etc., as they loop along, and there'll also be a PowerPoint, the PowerPoint slides available to you as well, so you can print them out if you like before you start watching the lecture, make notes on those printouts, etc., etc. The first 4 lectures will be online. Lectures 5 and 6, they will occur at the on-campus seminar, which is in April, and I'll get to that in a moment. They'll be given by 2 of the cardiologists that work with us, and then the last 2 will be online as well. So that's Principles of Cardiac Sonography lectures, the acronym PNCS. Then the Practice of Cardiac Sonography lectures, these will all be online, okay? And you'll access them again via views, via the Learning Zone, the PRCS lectures these will be. And we start with literally how to place the imaging probe on a patient's chest, different image windows, and then acquiring images, operating the machine, how to make sure that your images are aligned appropriately, how to start interpreting images, what measurements mean, and then writing reports as well. So they're the practice of cardiac sonography lectures. These aren't all the textbooks, but generally speaking, I might come back to those later. Generally speaking, all the textbooks will be available to you in an e-version. You can access them all via the university's library, and I'll show you later on the link for that from the Views site. Okay, so if you are happy with e-versions of things, you don't have to buy anything. If you like a hard copy, you can, but in short, everything will be available to you electronically. Once every semester, you'll come on campus for a seminar. They're really important occasions for you to come on campus, to meet one another, to meet the faculty, to practice the important practical elements of what we're trying to focus on in a semester. In first semester, you'll be coming on campus in April, and you come on campus for 4 days straight, okay? And there'll be very structured tutorials given. There'll be volunteer patients, ultrasound machines, and as I was saying, very structured tasks for you to do, so that you become very familiar with what we're trying to teach. In short, the kind of things we're demonstrating when you're on campus are the kind of things we're going to be expecting you to reproduce when you come back at the end of the semester for a practical exam. Okay. So as I was saying, there'll be ultrasound machines here. Initially, it will be ensuring that you can acquire images from different imaging windows, that you learn how to optimize images from gain settings to frequency settings to focal points to all the different elements that go into making good images will be a focus. The first semester seminar is from the 8th to the 11th of April. Generally speaking, you'll start in the afternoon from about 2 p.m, sometimes a little bit earlier, sometimes a little bit later, and we'll go all the way through to about 8 p.m. So about 7 hours or so each day. We have to start in the afternoon. Med students are here in the mornings. We get the afternoons, and there's quite a lot that's going to be covered. Okay, so come prepared to learn lots. And they're the dates: Monday the 8th, the Thursday the 11th of April. As I said, they're on campus, and I will give you details about how to get here, but the clinical school wherein all these are held is in Blacktown, which is a suburb in Sydney. The clinical school is part of the School of Medicine, and it is adjacent to a very big teaching hospital, Blacktown District Hospital. There are really good facilities here. Parking at times is not so good, but anyway, this is where it's going to be, and this is where most of, well, certainly all the on-campus seminars will happen. This is where all of your practical exams will happen. There'll only be one other site for exams, and that are written exams, and they will be at the Campbelltown campus, Western Sydney University. Anyway, you'll get very used to seeing that building there on that slide. This isn't the easiest slide to see, but I want to tell you just a little bit about assessments. Now, I won't go into them in too much depth yet, but with regards to the principles of cardiac sonography, this semester there'll be 3 assessment items, okay? You'll be able to see more about these when the learning guides, you see the learning guides from tomorrow via Views. The 3 assessment items are 2 quizzes, and they will both be online, and then a final exam. The online quizzes are a timed exam that are made available to you via Views. They're multiple choice questions, 20 questions in 30 minutes, okay? Now, they're an open book exam, so you can sit there and read your notes and whatever. That's fine. But you are expected to work independently, okay? So the very first question that you must answer simply states, are you working independently, yes or no? And if you're expected to answer yes. If you answer no, you can't, you can't do the exam. Now that's just one way of trying to reinforce to you that it's really important that this is, you recognize this as your own work, okay? The end of semester final exam is a written exam that will be conducted at the Campbelltown campus. It's over 2 hours and it has 3 parts: a multiple choice question part, a short answer part, and a long answer part. The multiple choice questions are, there'll be a choice of 4 possible answers, and it's a single best answer scenario. The short answer questions are, as the name indicates, short answers. You'll be expected maybe for 3 or 4 lines about a particular aspect, either in this case principles, maybe physics, maybe anatomy, and then some long answer questions. You're not expected to remember all this stuff. I'll reinforce these kind of things at the on-campus seminar, and leading up to the exam give you lots more, a much better idea of what to expect. With regards to the practice of cardiac sonography, assessment items are different. There are, in short, 4 assessment items, okay? The first assessment item is what's called an applied project, and that is, that has sort of 3 elements. The first is a facts part, and the second 2 elements, figures. So in short, you've got to provide some details about the anatomy of the heart, and then some figures to support what you're trying to tell in the details. You'll be able to see more about this when you get access to the learning guide. One of the important things I should reinforce about this particular assessment item is there are some really good resources available via the library, in particular a resource called Anatomy TV, which has got lots of great images and things like that, and facts about the heart that I would encourage you to use so that you can answer questions and provide, details as necessary. The written exam, which happens right at the end of semester, is very much like the written exam that I just described for the principles of cardiac sonography. The practical exam, it will be held at here at Blacktown each time, and it's something that you'll become familiar with. Will happen at the end of each semester, and it has really 2 parts. Most of the time, the practical exam is divided into 6 stations: 3 imaging stations and 3 non-imaging stations. The imaging stations, you'll literally be expected to acquire images and make measurements with a sonographer there, watching what you're doing. before you go into each of those stations, you'll have some idea of what is expected of you. And there'll be nothing expected you haven't done at the on-campus seminar, okay? The non-imaging stations will be either laptops or laminated images or something directing you to something on the screen or a certain abnormality or something like that you're expected to identify and then write something about, okay? There's also a logbook. The logbook has two aspects. One is you're meant to keep an imaging record, and hopefully everyone has received something about that. If you haven't received that, please let me know when you email me your supervisor's details, because I'll send that to you. Your imaging record is meant to be a record, as the name suggests, of what you do in the clinical setting, okay? I'll get to that a little bit more. The other part of the logbook is when you do submit your imaging record, there's also just a brief reflection on one element of your imaging. In first semester, will be a reflection on sort of some interaction with a patient that you need to discuss. Okay. The logbook. So over the course of 2 years, you'll be expected to have acquired a minimum of 1,150 echocardiograms in your imaging record, okay? That's broken up. In the first year, it's 475. In the first semester, 175. Now, if you haven't started imaging yet, don't stress, okay? The first semester, there's a little bit of flexibility. You're not expected to be acquiring images straight away. You'll be able to observe, and some of those observed studies you can make part of your logbook. Nonetheless, by a couple of months into the course, it's going to be expected that you're acquiring images by then, because by the end of the semester, you're going to have to submit something with no more than 90 observed studies and a minimum of 175 studies, okay? Now, an observed study is classified as a study in which you have acquired and measured less than 50% of the images and measurements, okay? If you've done more than 50%, you can call it your own. Now, over time, that is going to have to shift a little bit, and it's going to be expected by the end of the year that you're acquiring images and doing exams independently. But anyway, to start with, observation will suffice, but it's really important to appreciate that in time, the transducer is going to have to be yours, and you're going to have to start acquiring images and doing studies yourself. There's a little bit of an exemplar logbook. For the moment, I think I won't say too much more about the logbook. I'll go over it again. No doubt you'll have questions when you come on campus, and I think it's easier if I explain it in person when you're here for the on-campus semester and how to format it. To start with, I think it's just important that you start keeping a record of the dates, keep some record of the patient somehow. I mean, you want to de-identify it. Please don't send me logbooks with patient's name and date of birth, but you want to be able to refer back to your work and the type of study and how many studies that you do, and then I'll help you to refine how you're doing that when you come on campus the first time. Again, this is the e-learning platform. This is views. A really important zone is the communication zone. From now on, I will use email rarely, okay? I will, if I need to communicate with you personally, whether it be some, a relatively unimportant matter or something more important, and doesn't interest other people, I'll send you an email. Feel very free to communicate with me via email. Obviously I've got to check email multiple times each day, and I'll aim to get back to you as quickly as I can. But most of the time, announcements will be made via views, and there'll be multiple announcements each week. Initially, it'll just be, the lecture 1 is available, and in that announcement, I'll try and communicate to you exactly how to find it until you get really familiar with views. Over time, there'll be less need to spell everything out. As the on-campus seminar comes up, I'll be announcing some things to do in preparation for the tutorials that you do. As assessments come up, I'll be announcing just a couple of things related to those assessments. I'll be telling you as new things are made available on the e-learning platform. When you go to it tomorrow, you'll be able to access some things, but you won't be able to access all the lectures. The lectures are timed, for example. Some of the resources deliberately won't be available to start with, because if you've got everything, it can be overwhelming. So announcements are the way in which I'm going to be communicating with you and telling you when new material and the likes is made available. Okay. Resources. At the bottom of the learning zone there, you'll see PNCS1, again that stands for Principles of Cardiac Sonography 1, and PRCS1, Readings and Resources. So if you click there tomorrow, what you should see is something eventually that looks a little bit like this, and these are the texts and additional readings for Principles of Cardiac Sonography 1. Okay, so for Principles of Cardiac Sonography 1, there are 3 textbooks related directly to echocardiography, another one to physics, and another one just some effective study habits and methods. You'll notice that there are 2 echo textbooks. One that we'll be using very extensively is called the Textbook of Clinical Echocardiography. Another one by an Australian author who's very well known and very highly respected, Benita Anderson, who's from Queensland, and the anatomy textbook, which has got lots of different images and as a resource that you'll be wanting to use also when you submit your first Practice of Cardiac Sonography Applied project. The physics textbook is written by Rob Gill, who will give all the physics lectures, and he will give the physics tutorial as well. It's a really great resource. It's very relevant to everything we're going to be doing. It's written for sonographers with physics that is explained in easy to understand terms. It's an excellent resource. Now there are, certain things that we expect of you. As I was saying earlier, if something, for example, with clinical training goes amiss, if you're concerned about anything, if there's some special requirements or something, please contact me as soon as possible so arrangements can be made. With regards to things like online exams, and also in second year when you're going to be doing case studies and things like that, you're expected to submit your own work. Okay, the university has a very hard line with regards to plagiarizing people's work and cheating and things like that. And I understand that you guys are postgraduate students, so you've heard this before and you'll be familiar with that, but I just need to reinforce that from the beginning. And you're expected, obviously, to behave appropriately. And when you come on campus, there'll be volunteer patients here, and it's just expected that you treat the volunteers here with, with respect, that you work well with your colleagues, etc. I hope I don't have to say anything more about that, and I expect that you guys will be really well, behaved in every aspect. As I was saying again, if something comes up, please let me know. And then, rather than discussing it among yourselves, please let me know, because the easiest way to combat it is if we sort of try and get straight to the source, and hopefully I'll be able to help you to deal with things. You can reasonably expect lots of things of me as well, okay? I've got to deliver things in a professional manner. Things have got to be clearly explained. There are standards that we are expected to set. I've got to be fair with all the students. All of your work needs to be assessed fairly. With that in mind, you can be assured that all of the assessment items have very carefully set marking criteria. Okay, so things aren't just marked according to what the person marking it feels like. Things have been carefully developed, and we look at things very carefully. And we need to be able to make reasonable accommodation in terms of, if you're sick, or if something comes up, there's, an illness in the family, or you simply can't come to it. I understand that you're busy people, that you're working clinically, and we need to be understanding in that regards. Here's a list of people that you'll be familiar with over the next few years. Anne-Marie Hennessy is the Dean of the Faculty of Medicine. You won't see Anne-Marie a lot, but if ever there's anything really serious, you can communicate with her. You will meet her for a lecture in second year. Most of the time, your first point of contact is myself. There are cardiologists who you meet when you come on to the on-campus seminar, Suzanne Eshu and Timothy Tan, and they're both, their expertise is echocardiography, so you'll have some excellent and very experienced cardiologists to help you with things there. There are 3 other sonographers who'll be supporting you when you come on campus as tutors, helping you in with regards to image acquisition, image measurement, and then helping you all the way along. Fernando, Kristen, and Kenny, they've got lots of experience. They're really good at what they do, and they'll be able to give you lots of really good support. Penny Lee provides, I can see a typo there, it's not Pent Lee, it's Penny. She will provide the admin support for the course. At times there'll be questions that Penny is much better at answering than I am, and if you send an email to me and I think I need to forward it on to Penny, I'll do that in a manner that hopefully you'll appreciate that it's gone through to her, and she'll get back to you as soon as she can, I'm sure. The specialists, well, Rob, as I was saying, Rob Gill is the physics expert. He'll be giving all the physics lectures and tutors. David Tannis you'll meet in second year. His area of expertise, he's another cardiologist, is adult congenital heart disease, and he'll give a tutorial and some support in terms of that. The library person, Lily Collison, you'll meet her in second year, but she helps to make sure that all the library resources are up to date. If with regards to your assessments and things like that, you're concerned about things like referencing or source material or anything like that, Lily's very quick to answer questions you may have. So you can look her up in the staff directory, and her email you'll be able to sort of find. I'm absolutely certain of that. There are some email addresses, mine, Penny Lee, Lily, who's the librarian, and Anne-Marie Hennessy. As I was saying, I'll most often be your first point of contact. Feel very free to email me whenever you need to. There's a scholarship that is on offer to a student every year we start, and everyone is welcome to apply. There is selection criteria. With regards to the scholarship, the value is $10,000 per year for 2 years. The selection criteria you can see by clicking on the link. In short, preference will be given to people who have Aboriginal heritage. If there is no one who applies that has Aboriginal heritage, the next preference will be given to people who can indicate some special need. It may, for example, and this is just an example, be someone in remote or a rural area. It may, and this is just an example, be someone who is new to Australia. But GE, who are a very strong supporter of ours, really want to support people who've had some hardship and want to give them every opportunity available with regards to studying the course, and so that scholarship is open. Applications close on Friday the 15th, and that date is set, okay? So if you are interested, it will take a little bit of work. You'll need to, obviously make a submission and indicate via that link why you think you are eligible, and that will require a little bit of work. So I might stop there for just a moment. I might stop sharing, and you can perhaps, hopefully, you'll be able to see me again. Can you see me? Maybe. Now, I'm open to any questions. Please feel free. I'll try and answer them. If you've got a question that you think is a little bit more personal, or you're a little bit embarrassed to answer, contact me later on. But if you want to ask a question now, please let me know. Silence, okay. I hope it's not awkward silence. Look, this is recorded, so if for any reason you want to refer to something, that we discussed, or you came in halfway through, you can go back to the start. I might just go back to the slides again for a moment. There's a couple of dates here. Let me just, sorry, I've forgotten to do something. Let me just share my screen again. Where are we? There it is. So they're the two, well, there's one date. Where's the other one? There's the other one. Okay, so they're the two things I really want of you immediately. So please, your supervisor's name, phone number, and email address. Now, I won't use their phone number unless I really have to. Most of the time, I'll just contact them via email. But there are a couple of things that I do want to send to them. And then from time to time, I might need to phone them. And then the first on-campus seminar, as I was saying, is in April. Is there anything else that I needed to tell you guys? That's right. You'll all be able to access the e-learning platform from tomorrow. If by the end of the day tomorrow you can't access it, please send me an email. It's probably just something very minor, and I'll be able to give you access. Lectures don't start until next week. So you've got the remainder of this week and over next weekend to just get familiar with things. If there's two documents that I suggest that you get really familiar with, it's, I'll just share something else with you. It's the learning guides. So I hope you can see the screen here. The learning guides are the documents that really should include everything that you need to know about the course, from what lectures will be delivered, tutorials are given, assessment items, their weighting, when you're expected to come on campus. Now, the learning guides can only be so long, and there are some details that won't be included, but you'll be given in time. For example, some of the marking criteria you'll be told a little bit later on. But the learning guide is something for each of the units that is really good to get familiar with. Okay. So may I suggest that you just make yourself familiar with views, that you look at the learning guides, and you might want to click on over here as well to the list of resources. So there are your textbooks for principles of cardiac sonography, for example. If we go back, there are your textbooks for the practice of cardiac sonography, for example. If we go back, this is a flying introduction to views. If we go here to the learning zone, this is what you're going to expect to see when you open up the principles of cardiac sonography. There are 2 modules, as I was saying, anatomy and physiology, and principles and physics of ultrasound. There's nothing in there yet, but there'll be lectures that become available over time according to that plan that I was giving you, and you'll be able to see all the lectures that you can expect to have in your learning guide. When it does come round to getting grades, you'll be able to access your grades. Obviously, it's confidential, so you'll be able to access yours and not other people's. The assessment zone there is where some of the online exams will be made available and other things. Anyway, I've said lots. I'll come back here. So that's it in a nutshell. As I said, if you've just joined us, don't worry, this has been recorded. What I'll do is I'll have to now just stop. It takes a little bit of time just for Zoom to save everything. I'll post everything we've covered here on views tomorrow. As I was saying, you should all be able to access views tomorrow. You'll be able to see this again if you've joined late or you want to see it again. The slides that I used today will be available via views, the learning guides, etc., etc. Please send me your supervisor's name, email and contact number. Feel free to contact me via email. If you need to, you can contact me via phone. I'm very happy, especially if it's something that is urgent. If it's something that's not urgent, I prefer it be via email. One other thing, please get used to using your university email. I'll be expecting you to use that. Anything I send to you via email, I'm not going to be sending to personal emails. It's just too hard to keep a track of that kind of thing. I'll be sending it to your university email. As I said earlier also, most things I send out to you, or most of the time I'll be communicating with you via the announcements, okay? So unless it's something that just you need to know or something personal that you've asked me to look into or something, it won't be via email, it'll be via announcements. There'll be several announcements each week. So, you know, just get in the habit of when you get home, you know, having a look, seeing if there's something new posted, if there's a new lecture, if there's a new tutorial, pre-tutorial plan or something like this. Okay, I might pause there. I've said lots and lots. And as I was saying, this will all be available to you. I really look forward to meeting you guys when you come on campus in April. There's going to be lots of things happening there. There'll be a number of really good tutorials given by different people. There'll be lots of practical classes. You'll be looking at pigs' hearts. You'll be imaging, you know, volunteers' hearts. You'll be using state-of-the-art ultrasound machines. We're supported very strongly by both GE and by Philips. They give us excellent support, and they will do so all throughout the course. If you're interested in the scholarship, I recommend that to you. The 15th of March is the date when submissions are due for that one. Anyway, thank you for taking the time to check in this afternoon. The e-learning platform will be available to you tomorrow. It's nice to see a few of your faces. Some of you I can see, some of you I can't. Some of you I can see have been drifting off to sleep. I'm glad that that most of you have managed to stay awake. If you've fallen asleep, I'll take that as a compliment. My voice is obviously not that harsh. Okay. Yeah, I'll see you guys in April. You'll hear my voice. You'll get to go to sleep again in some of the lectures that are online, because
burning the candle at both ends, Paul. Sorry.
Yeah. You're right, Andrew. No worries. Okay. All right. Good to see you guys.
Thank you.
See you in April. No worries. It's a pleasure. Feel free to contact me. I'm here to support you. I want to make this a really great course. You guys should feel very much a part of it. With that in mind, within reason, if you think there are things that need to be improved, there are means to do that. If it's small matters, be in touch with me. Please let me know. At the end of each semester, there's always feedback asked from students, and almost always there's 2 or 3 students who take a little bit of time, but the course will improve a little bit if we think about it. It'll improve a lot if you guys give us feedback. So I'm very open to that. I think it's really important. Anyway, I've said I'm going several times, and I'll make this the final time I say that. Nice to see you all.
Thank you.
Okay, good one.
Thank you.
See you later.
See ya. Bye-bye.
Bye.
Bye.
Bye. Thanks.